What should be used to treat dystonic reactions? IV diphenhydramine. Can you diagnose Parkinson's disease with a physical exam? Yep, history and physical to diagnose Parkinson's. And what are the two main medications to treat Parkinson's disease? Levodopa or pramipexole? If you have a patient who's coming in from a seafood restaurant and they're like all flush and have cramps and headache and diarrhea, what should be at the top of your differential? Scombroid poisoning. So you want to obviously empathize and engage with your patients. True or false? Stopping smoking at any time has beneficial effects for the most part. True. How do you treat priapism? Phenylephrine, and it needs to be intracavernosal. That sounds like it hurts. Probably not as much as the priapism. With regards to female pain issues, do not confuse adenomyosis with endometriosis, right? Adenomyosis does not respond to medications. Is it fine for employers to discriminate based on genetic tests? No, no, it is not. Employers cannot discriminate based on genetics. At times, do you need to report physicians for wrongdoing or being bad or dumb? Yes, sometimes you may need to report physicians. Can Candida albicans cause a scaly rash? Yes, Candida albicans can cause a scaly rash. A non-ejection click and murmur is associated with mitral valve prolapse, and it may vary depending on what? Body position. Non-classical adrenal hyperplasia, androgen excess without salt wasting. Keep it in mind. What is a condition that affects the hand, foot, and mouth? It's hand, foot, mouth disease. And what organism causes it? Coxsackie virus. And note that it doesn't always need to be all of those locations. It can just be the hand in the mouth or the hand in the foot or just the foot. So don't get confused. If you have someone and you suspect that they have HIV but they don't have any P24 antigen, what should you do? Repeat the P24 antigen HIV antibody immunoassay at a later date, right? It just might not be rising at that point when you're testing them. Also, check for hepatitis in those HIV patients or concerned for HIV patients. What mutation is associated with cystic fibrosis? Delta F508. Well, there are other ones, but that's the one that you need to know. A chest CT scan can help diagnose a non-resolving pneumonia, by the way. Lateral femoral cutaneous nerve entrapment can cause what? Myalgia paresthetica. So that is not muscle weakness and it's a decreased sensitivity on the lateral thigh. For myalgia paresthetica, what is necessary? Weight loss. Weight loss is necessary. What is good to treat hypertension in patients with gout? Losartan. If a baby is delivered after 18 hours of membrane rupture, what sort of antibiotic prophylactics will they need? Well, they will need some antibiotic prophylactics, right? For a patient with recurrent UTI, postcoital antibiotics may be needed, right? So we're talking a lot about antibiotics, right? Let's flip it. Does COPD exacerbation need to be treated before surgery? Definitely. What condition is characterized by painless blisters, hyperpigmentation, and hypertrichosis? PCT, porphyria cutanea tarda, right? In general, when does cervical cancer screening begin? In general, at 21 years old. Is systemic lupus erythematosus associated with coronary artery disease? Yep. SLE is associated with CAD. And if newborn's mom did not receive GBS antibiotics, you should observe the baby for how long? For 48 hours. If you suspect a pancreatic cyst, what should you do? You should do an endoscopic ultrasound with an aspiration. In certain cases, parathyroidectomy may help what condition? End-stage renal disease. And some other ones, but yeah, end-stage renal disease. What medication may help with acute treatment of platelet dysfunction? Starts with a D. Desmopressin. If your patient is having a catatonic-like event, what medication should you give them? Starts with an L. Lorazepam, right? A patient with a TSH secreting pituitary adenoma will have increased TSH. Is that true or false? That's definitely true, obviously. And note that hyponatremia is associated with hypothyroidism, so you want to treat that hypothyroidism. And for a patient with organophosphate poisoning, you want to treat them with what? It starts with an A. Atropine. What condition is an autosomal dominant defect in fibrillin, and patients have long limbs, ectopia lentis, and increased aortic risks? That would be Marfanoid syndrome. FYI, there's a good prognosis of patients on HIV medications if their CD4 levels are rising. And if you suspect autoimmune hepatitis in a patient, you should order what? 2 major lab tests: anti-nuclear antibodies and anti-smooth muscle antibodies. And note that some patients, like if they use needles or have risky sexual behaviors, should get the Hep B vaccine. And if your patient's having complications of diverticulitis that does not improve 2 to 3 days after antibiotic treatment or a colonoscopy is contraindicated in them, since a colonoscopy is contraindicated in them, what imaging should you get? CT scan, right? CT scan of the abdomen and pelvis.